Hello friends, welcome to my channel. Dear friends, let's talk about premenstrual syndrome, PMS, symptoms, causes and treatment. Many women feel physical or mood changes during the days before menstruation. When these symptoms happen month after month, and they affect a woman's normal life, they are known as premenstrual syndrome, PMS. PMS is a group of changes that can affect you on many levels. They can be physical, emotional, or behavioral. The changes come 1 to 2 weeks before your period. Once your period starts or soon after it starts, they'll go away. Premenstrual syndrome refers to changes in mood and emotions, physical health, and behavior that develop between ovulation and the start of your period, roughly the 2 weeks before your period, last until a few days after your period begins. Show up consistently each month. Have some impact on everyday life and regular activities. PMS is a very common concern. Nearly 48% of women who are of reproductive age experience PMS, and for about 20% of them, symptoms are severe enough to affect their regular routine. PMS is a group of changes that can affect you on many levels. They can be physical, emotional, or behavioral. The changes come 1 to 2 weeks before your period. Once your period starts or soon after it starts, they'll go away. Symptoms of premenstrual syndrome, PMS. While PMS often involves mild or moderate symptoms that don't majorly affect daily life, symptoms can be severe enough to impact your everyday activities and overall well-being. If you have PMS, you'll experience symptoms consistently before each menstrual period. You might experience only some of the symptoms below, or several, but PMS typically involves at least a few different symptoms. Emotional and behavioral symptoms. PMS-related changes in your mood, emotions, and behavior might include anxiety, restlessness, or feeling on edge, unusual anger and irritability, changes in appetite, including increased food cravings, especially for sweets, changes in sleep patterns, including fatigue and trouble sleeping, a sad or low mood, which might involve tearfulness or sudden, uncontrollable crying, rapid shifts in mood and emotional outbursts, decreased sex drive, difficulty concentrating or remembering information, physical signs, bloated tummy, cramps, tender breasts, hunger, headache, muscle aches, joint pain, swollen hands and feet, pimples, weight gain, constipation or diarrhea. What causes PMS? Scientific research hasn't led to a conclusive cause of PMS, or an explanation for why some people experience it more severely than others. Cyclical changes in hormones. Many experts believe PMS happens in response to changing levels of the hormones estrogen and progesterone. These hormones naturally fluctuate throughout your menstrual cycle. During the luteal phase, which follows ovulation, hormones reach a peak and then decline rapidly, which may lead to anxiety, irritability, and other changes in mood. Chemical changes in the brain. The neurotransmitters serotonin and norepinephrine have several important functions in the body, including helping regulate mood, emotions, and behavior. These chemical messengers may also factor into symptoms of PMS. For example, a drop in estrogen may prompt the release of norepinephrine, which leads to declining production of dopamine, acetylcholine, and serotonin. These changes can trigger sleep problems and lead to a low or depressed mood. Existing mental health conditions. Living with a mental health condition, such as depression or anxiety, could raise your chances of experiencing PMS or premenstrual dysphoric disorder, PMDD, a more severe form of PMS. A family history of PMS, bipolar disorder, or depression, including postpartum depression, can also increase this risk. Lifestyle factors. Certain habits might affect the severity of your PMS symptoms. Potential lifestyle factors that could worsen PMS symptoms include smoking, eating a lot of foods high in fat, sugar, and salt, a lack of regular physical activity, a lack of quality sleep. What can I do to manage PMS? There are lots of ways to manage PMS. Even if you can't totally fix it, it's nice to know you have the power to help yourself. These ideas might help. Exercise about 30 minutes a day. Eat healthy foods like whole grains, fruits, and vegetables. Try to get enough calcium from foods, think dairy, green leafy vegetables, and canned salmon. Avoid salt, caffeine, and alcohol. Don't smoke. Get plenty of sleep. Work to lower stress. Thank you for watching my video. See you in my next video. Bye.